So, hi there. I'm glad you're here with me today. And in this video, I'm going to talk about low-carb diets and diabetes. I get asked this a lot. There are a lot of patients out there who have diabetes, and it's out of control. They have their blood sugars not under control with the medication that they're taking. They have to keep taking higher and higher doses of that medication. And so one of the things that goes on when that happens is they see their dietitian, maybe they're through an insurance network, and the dietitian, the usual advice is eat 45 grams of carbs with each meal. And then, you know, that's a lot of carbs actually. And it actually does not help them to eat that many. But so some people decide, well, I'm going to go low carb then, because I read somewhere that going low carb with diabetes is a good idea. Because other methods of thinking of type 2 diabetes say 45 grams of carbs per day. Now, if you're shifting from 45 grams of carbs per meal to 45 grams of carbs per day, obviously you need to do that under supervision of your doctor, because that could be very, very, very dangerous to just make that drop. And if you're, having the same medication level, whether it's insulin or metformin or one of the others, it could put you into hypoglycemia and a diabetic coma. So you have to do that under supervision of your health practitioner. But often I do find that my type 2 diabetes, especially, they are helped by a lower carb diet, and they can decrease their overall need for medication, and they'll probably lose weight in a slow, safe, gradual way if they need to lose weight. But I want to stress that just because you read something online and you want to try to do it yourself, that is very unwise, because you could get very, 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 very sick and die very quickly if you go into a hypoglycemic or ketoacidosis sort of shock. So make sure your levels are good at all times. Gradually wean into something like that, and watch your blood sugar levels and work with your physician to adjust your medication levels. But in general, type 2 diabetics do better on a lower carb diet. But you got to do that. You got to be safe. Okay? So that is my little spiel today about diabetes and lower carb. Is it safe? The answer is only if you do it under supervision. And then it can be very beneficial for your health. But otherwise, it could be very, 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 very bad. So anyway, making that transition, do it under supervision, and if it's not working, then you can always adjust the carbs accordingly. So that is my spiel for today. And if you like this video, if this was useful information for you, you can go ahead and like and share on Facebook, Instagram, or Twitter. And I hope you have a great rest of your day.